Hi there, everybody. This is Dr. Beth Innes coming to you live on, let's see, a topic dear to my heart, talking about why the importance of, why is it important to have blood work and vaccine titers in pets. So let us get started. The interface has changed a little bit, so just bear with me as I make sure I know what I'm doing here. Perfect. Okay. So I am Beth Innes. I am the owner and veterinarian at Sleepy Dog Veterinary in Arlington, Massachusetts, where we are um, providers and lovers of alternative medicine and now incorporating more integrative medicine into our offerings. It's a snow day in Arlington. There was reported to be a parking ban, so I am home today. The parking ban has still snowing, so we will see you all tomorrow in person. So, okay, let's get started. So, some general thoughts on blood work in pets. I'm just going to focus right now on blood work. I'm not going to do other laboratory tests, though I have lots of enthusiasm for those as well. But for right now, we're going to focus on blood work to keep it a little bit simpler. What I'm going to cover today is what information are we looking for when we're running lab tests? How often are we looking for it? How will it change what we do for our pets? How stressful is it for our pets? And what is the cost? Who processes it? And I'm going to also touch on vaccine titers, which is very exciting these days with all of our pandemic things going on. So that's what I'm going to chat about today. All right, so what information are we looking for? The first thing that I will bring up is screening blood work. So screening blood work tends to be used when we are looking for a baseline for animals, or we're looking to do some kind of procedure that maybe we would want to know that all systems are go before going forward. So something like maybe we want to give a little sedation to take some x-rays. Maybe we want to do a dental procedure, something like that. So the screening blood work that we usually lean on for reasons such as that would be a complete blood count, which looks at our red blood cells, our white blood cells, and our platelets and the nature of those cells. So both the numbers that we see there, how many red blood cells, we certainly need a certain number to keep things going and keep our blood oxygenated and our tissues oxygenated. And then we also need a certain number of, or certain parameters that tell us about the health of those cells or how fast they're being produced. So we're looking at that in the complete blood count. Blood chemistry is the other common thing that we use for screening, and that looks more at some functional values. So how is the liver doing? How are the kidneys doing? What about some of the enzymes that we use to reflect on the state of the gastrointestinal tract or the pancreas? How about electrolytes? Are the potassium and the sodium and the chloride all at the right levels, or are we a little dehydrated, or is there something going on that's amiss in the perhaps the adrenal glands? So all good information to have. All of these things will fall in a range for what is normal for that species. That is reported by whatever laboratory we're using or machine that we are using. And we go from there and determine what is normal, what is high, and what is low, and what that means to us. The other things that we often will use for screening tests is something called a 4DX test, which most animals get annually. Most, I should say, dogs get annually, and that is to test for both heartworm disease and some tick-borne diseases. Here in Massachusetts and New England, we see a lot of Lyme disease and a lot of anaplasmosis, and we can find those as flagging positive there and decide whether we need to act on that information. The other things that test screens for are ehrlichiosis, another tick-borne disease, and Rocky Mountain spotted fever, which, believe it or not, we do actually see here in the Northeast. So that's kind of our screening blood work that I come to think of as what we are looking for in what looks to be a healthy animal. If we're doing some more targeted blood work, we're going to do sometimes some more kind of investigation into additional parameters for animals. So we might want to use this for an animal that has some kind of challenge that we're seeing. If they're having gastrointestinal disease that is not clearing up with the typical medicines and treatments, nutrition that we usually use, we might want to look into some autoimmune panels if we're suspicious that there's something going on there. We might want to look further into infectious disease. Is this something that maybe we think an animal was exposed to something and we might want to look for particular infectious disease agents. Maybe this animal is on medicine or a has a certain hormonal imbalance that we want to check in to see, is the supplement that we're giving or the medicine that we're giving at a therapeutic level in their bloodstream, but also is the medicine that we're giving having any effects on the organ systems. Something that is a good example of that would be a seizure medication. So animals that have so many seizures that they need medicine to be controlled, we often put them on medicines, and we want to see the therapeutic level in their bloodstream. And we also want to make sure that it is not affecting certain organ systems like their liver, which is sometimes hard pressed to do a lot of work for those medicines. So those are some kind of more targeted panels. The other thing that we will use blood work for is some components of allergy testing can be via the bloodstream. That is depends on what allergy we are seeking, whether it's accurate or not, but sometimes we will use that as part of allergy testing. And then the last thing that I think of when I think of what are the most kind of common and valuable things to me, particularly at Sleepy Dog, we do a lot of vaccine titers. So we'll speak to that at the end of this. All right. All right, so the next question is, how often are we looking for these values and how often are we running blood work? So in the typical veterinary response is always, it depends. So it depends on what we are doing. If we're screening in healthy pets, and particularly in healthy young pets, I think most veterinarians agree that we would love to have a look at that blood work once a year. So we certainly want to check for heartworm and tick-borne diseases once a year, but also looking at liver, kidney, red blood cell counts, white blood cell counts, etc. The question I think that comes up a lot is when is my pet considered a senior pet, and what does that mean in terms of monitoring and kind of an annual look at things. And so that is, I think, up for debate. If you ask me, a 7-year-old pet is probably like an average, but there are some small breed dogs that I think are at 7 is totally young. Same with cats, but I think 7 to 9 has generally been the demarcation, I would say, in most of veterinary medicine for when to be a little bit more regular about the testing. For me, if a pet is 7 years old, 9 years old, or over, I would love to see our screening blood work done twice a year. If you think of how old pets are or how long they live compared to people, they advance a lot more in the amount of time that it takes for us to go through 1 year. So while our doctor, like my doctor when I'm age 43, is going to say, you need blood work every however many years, 5 years, that's a lot. 5 years is a whole lot longer of a span in the life of a cat or dog. So we like to see it more frequently when we can. It also depends on the risk factors and the general health of the pet. If it's a pet that's having some unexplained symptoms, we might want to do it more frequently. If we're seeing weight loss, we might want to do it more frequently. If we know that they have a chronic disease condition, we might want to do it more frequently. So something like kidney disease, let's take my 17-year-old friend who lives in my house, Roosevelt Innes. We, in an ideal world, would probably check his kidney values every 3 months because they could change drastically, and that might change what treatments we would do for him. All right. So the next question would be, how will it change what we do? So if the lab work is normal and the pet is normal and not showing any surprising symptoms or anything unexplained, then we would honestly get some calm and comfort from that information, and certainly we would get a baseline for them. So what is the normal red blood cell count for this animal, or what is the normal liver value range in this animal in particular, so we can look at trends. I would say veterinary medicine and certainly integrative medicine is all about trends. So I'm not going to panic if we see a little bit of elevation, but I'm going to keep my eye on that. Um, if it is abnormal, then we might think of next steps. So let's say we have someone that is flagged for having some high liver values. And we would say, that's not normal. I don't like that. So I'm going to consider, do I want to do some more testing? Maybe that testing would include imaging, like an x-ray, to see what the shape and size of the liver looks like. Maybe it would come in the form of an ultrasound to see what the architecture of the organ looks like, and take a peek at the gallbladder, which you can't see on an x-ray. Maybe it would lead us to do some urine testing to make sure that we don't see anything abnormal there. Maybe it would take the form of looking at the stool sample, or maybe we would want to do some more liver function tests, taking maybe a sample of the blood before a meal, then taking a sample after a meal, and comparing some things like the bile acids is one of those things that we look for liver function. We would often most likely lean on some medicines and supplements and different treatments depending on what those abnormal flags are in the blood work. So if we're going in the case of the liver, if we see something where we see a spike in liver values, we might lean on something like SAMe and milk thistle, because that is a really helpful thing to kind of help the liver to heal. We might want to, if we have a suspicion that there is some kind of infectious cause, we might want to lean on some antibiotics, depending. We might want to do some fluid therapy to get a little bit more hydration, get the body cooking a little bit. Perhaps we need to manage appetite and nausea because the liver is causing some changes in appetite. The other thing that it can sometimes do is, if we as general practitioners don't know what the cause is, and we're not getting somewhere with our treatments, or we are worried that there might be something underlying that we cannot figure out just yet, we may send them to a specialist. Maybe there's someone in internal medicine if we're thinking about liver issues, or maybe there's someone in dermatology if we're thinking about allergy issues, something like that. Also, the other thing that it can affect if we're finding abnormal values in the lab work is we're going to have a different monitoring approach. So with my olden days kidney cat, Roosevelt, I'm going to check his blood work more frequently. If it is, and more frequently for him might mean every 3 months. If we have a liver problem that's an acute liver problem, we're going to try some of our medicines and we're going to check back a lot sooner, because that's a little bit more of an acute situation. So those abnormalities can help us choose when we're going to check in next. If we have a patient who tests positive for Lyme disease or anaplasmosis, we're most likely going to check in on some of our red blood cell and white blood cell counts, and we're also going to check in on titers in about 6 months. So all these things inform when you're going to see us next and what we're going to expect in between. All right, so how stressful is this for our pets? I would say in general, our pets are very, very brave, and they are certainly much braver than me. So for the most part, when we're getting a blood sample, we are getting a sample from one of the body's veins. And so often we're going to do, one of us, whether a nurse or a veterinarian, is going to give a nice gentle hug to our pet, and we're going to hold off a vein to make the vein kind of pop a little bit. If you think of when you're going to give blood at your doctor, oh, that's the tattooed arm, we'll use this one. They put a tourniquet up here, and then they're kind of making it so that the vein puffs out a little bit so that they can feel it and go in there with their needle. See if we can do a little example on Mr. Otto. All right. So for animals, I'm not at the clinic now because of the snow days, so we'll make do. Here's Toto Innes. There are several places that we can get a blood sample. One is going to be this rear leg. Oh, so cooperative. So I would either use a tourniquet or my human tourniquet here. And hold off this area so this vein down here pops a little bit. I would put a little bit of alcohol on this area and then I would put my needle in right here. As you can see, this part doesn't stress him out very much. Of course, he's at home, so he's not as excited. And I'm not actually poking him, but for the most part, he's a really good guy for blood samples. The other area, let me just move over here. Everyone can see the state of my office here. This is the front of his body. So another area that we might go into is the cephalic vein here, where I would hold off up here, and that's all it takes. His vein comes right here, it pops out. He's only 6 years old, so he's got a nice set of veins on his body. Nice little bit of turgor there to help things pop, and then I would get my sample here. If I needed to get a large amount of blood, or because I'm looking for speed, I might do a sample from his jugular vein, which ordinarily he would be sitting, and Sam would be holding him, or I would be holding him for her, and we would extend his neck up, instead of doing a tourniquet, because of course we wouldn't want to do that around his neck, we would hold the area where his jugular vein goes into his chest cavity, and it kind of pops up here. We'd put a little bit of alcohol on and we go up there. And while it sounds very surprising, animals tolerate that really nicely, because there's not a lot of nerves there for us to poke them, and also because sometimes the position that they're in might be more comfortable. The other thing that at Sleepy Dog we take a lot into account is what's comfortable for that particular animal. I think that's true for most veterinarians. But so if it's someone who doesn't like us in their face, we're not going to go there. We might not even go in their front leg. But if it is someone that doesn't mind that nice hug up front, then we're going to be more likely to do that. And some animals feel a little bit better if they have a little squeeze like that. For a cat, we're probably most likely to go into a back leg because it's a little bit more comfortable for them and a little bit less scary. For them, we typically have them like almost like in a sideline position. So they're kind of, well, they are actually very much like Otto is right now. Oh, he just moved. But they're kind of lying on their side, and we kind of sneak their rear leg out, and then we can kind of access that. We can show that in another video. I'm not going to bother Roosevelt right now because his dad is on a conference call, so I will not do that right now. But we can do that in the future if anyone is interested. Usually what we do is we take about a 3 cc sample of blood, so not a lot, but it gives us a lot of information. And I usually say it's unlikely that those animals are going to miss it. It's not enough for them to feel weak or anything like that. It's not like a blood donation where it's actually asking the body to regenerate a lot. After we do our sample, we apply some gentle pressure to the area, so they do have to sit with us for a little bit. If it's a dog who's bounding around, we might put a little bit of a Band-Aid on with a little bit of a gauze pad and a wrap around it. I think that one of the things that brings me the most joy in animal medicine is that an animal can give a blood sample, and the Band-Aid is the most stressful part. The blood sample is not always the most stressful. So generally we tend not to use a Band-Aid unless we have to, because it feels funny to them and they'd rather just have us sit there and put a little pressure there. And then off they go. There is not, usually it takes just a few minutes. In animals who are older, their vein structure can be a little bit weaker, or depending on their hydration and what's going on in their body. They also have often had a lot of blood sampling, and so sometimes they can develop a little bit of funny scar tissue for those with really chronic disease, like if they've had chemotherapy or something where they have had to give a lot of blood or have a lot of medicine. So we try to give ourselves and our patients enough time to find the best way to access a blood sample, the most comfortable, and also just make sure that we are paying attention to what is kind of the best for their body. But in general, not very stressful. I would say it is most commonly stressful for those that are just uncomfortable either being still, uncomfortable being restrained. I think the prick of the needle is about the same as with us. It's like a pinch, and it can be very irritating if you are in the wrong place or if you move suddenly. But in general, if it's a pretty quick in and out, and in general, most animals don't have a real problem with it. Next question is, what is the cost? And again, the typical vet answer, it depends. So it depends on what you're looking for. There are some tests that are more reasonable than others. We as veterinarians are pretty dependent on what our lab, what their fees are. So it kind of depends on where you are in the country, and what we are being charged, and also what we're running. The more extensive the blood test, the more cost it's going to incur. I like to think of it as the more information we have up front, though, the less it will be over the long term. I think another thing that happens in veterinary medicine is that we are often compared to people medicine, which totally makes sense. But most people don't have insurance in the same way, though I'm happy to see that there are more and more pets who have pet insurance, because I really, really think it helps a lot. But if even with that, we in veterinary medicine, bills are paid by the client, and then the client is reimbursed by the insurance company. So there's a lot more clarity in what the costs are. In people medicine, we don't get the bills in the same way. So it is never the case that veterinary medicine is more expensive than people medicine. It's just that we see the different bills. We see the bills in a different way. All right. And then the next question that I'm asking myself is, who processes the blood work? So again, that depends a little bit on the situation. So if it is an urgent situation, I'm worried that my patient is losing blood, I'm worried that my patient is in some kind of organ failure, then my best bet is going to run the lab work in-house, in which case I ask my nurse Sam to help me run this through these machines that intimidate me, but she is on top of. And then we can know within a matter of minutes what things are looking like. We can't do all the lab work that is required in-house, but we can do the CBC, the chemistry, and those electrolytes. If it is something that we want that information that day, because maybe we're doing a procedure, we might also run it in-house. Or if for some reason the cost is better to do it in-house for that particular test, we will run it in-house. Does not take long, but it does take some resources, and we do have to plan it in. There's also SNAP tests, which are done relatively quickly, usually in a matter of 10 minutes or so, and those are also run in-house, and those can be things like that 4DX test, the one for the heartworm and the tick-borne diseases. That can be run in-house or at the lab. We tend to do it at the lab just because we tend to have other things that go out with it. You can also do screening for feline leukemia and feline AIDS virus. Those can be done in a SNAP test, as well as there are a couple other ones now, one of which is a pancreatic screen for pancreatitis, which can be really helpful to know sooner rather than later. In veterinary medicine, our labs tend to be, the biggest ones are IDEXX, which is the one Sleepy Dog uses, and Antech, which is another large lab corporation. We at Sleepy Dog also use one called Hemopet, which is a laboratory that we use for some special thyroid testing, and we use them for our vaccine titers. We also use another lab called VDI, which is a great lab. We do some vitamin D testing, B12 testing, hyaluronic acid testing, some of the different magnesium, things like that, some of the different things that we look at for different things like arthritis, cancer, some ability to screen risk factors, and then also gastrointestinal disease. We use Spectrum for our allergy testing when we do that. That's not that common, but we certainly use it now and then. All right, so vaccine titers. So in this age, this is a really excellent topic to be discussing. The way we use vaccine titers is because a lot of our patients have chronic conditions and we're trying to not over-vaccinate them if we have the ability to do so, we'll use vaccine titers, and we're starting to incorporate that into our integrative medicine too, just to save the body like the work that it has to do when it comes to vaccines. So when an animal is a puppy, a vaccine is given. Let's say it's a puppy. It could be a puppy or a kitten. Let's say it's a puppy, and we are going to give their puppy series. So we would do a distemper vaccine and a parvovirus vaccine, which are really, 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 really yucky things to have as puppies. So we definitely want to protect them against that. We give a typical series as puppies, and then either at a year we give a follow-up vaccine, or we can sometimes do a titer at that point. The titer measures the antibodies in the blood that the animal has so that we can measure if they are protected if they were to be exposed to that organism in the future. So if they have enough antibodies or protective cells in their immune system that if they come across a little parvo particle or load, they can effectively fight that off. If that is the case, then they do not need the vaccine, and we will recheck it in 3 years. If it is not the case and it looks like their antibody level is lower than it should be to be protective, then we will booster them with the vaccine. This makes me feel really good because I feel like I know more about that animal's body, and I know that I'm giving the vaccine for a good reason and that they need that if we need to do it. And if not, then they are protected and we can go another 3 years. So the important part of vaccine titers is that we need to have a documented range of what an animal species needs, the level of antibodies that they need to have in their blood to fight the infection. So for things like distemper, parvovirus, in cats, we can do Kalichi virus, panleukopenia, and a couple other ones for the kitties, but we don't have that range for rabies, and as well, not all states recognize rabies titers as enough for proof that that animal is protected. And because rabies is so scary for other animals and also is zoonotic or transmissible to people, we have to be really careful about that. So at Sleepy Dog, we're not fans of doing the rabies titers unless there's a reason that the animal is we wouldn't vaccinate them anyways, and we're trying to make sure that they have proof that that client is doing their best to keep their animal safe, but we cannot do the rabies. That would include cases like if an animal was actively in a cancer crisis or having some kind of acute disease, we would try to avoid that. But if an animal is healthy, we tend to use the rabies vaccine because that, in the eyes of the law, is the most effective way to control rabies, and rabies is really, really bad, as we all know. All right, so with all that information, as I'm looking at my time, I would say the final question is always going to be, what is right for my pet? So again, that answer depends. So you want to discuss this with your veterinarian or your veterinary team. If you're a Sleepy Dog patient and client, then please feel free. We would love to talk about this all day long because it is dear to our hearts. But it definitely depends on what your particular pet's makeup is, how old they are, how young they are, if they have any conditions, what their lifestyle is like. So are they a dog that's out in the woods and very susceptible to things like leptospirosis, which is another vaccine that we consider a non-core vaccine, so is optional. But if you have a hunting dog, that might be a really legitimate thing to do because we don't have ways to protect against that otherwise. It also depends on how much they travel. So if they are going to be traveling overseas, it's going to make a difference in how we approach their vaccines and their titers, and their blood work and all their screening as well. So I hope that is a little bit helpful in terms of what the value is of blood work. So much value, and why we would choose vaccine titers and why we would choose vaccines. If you have any questions, the only thing about this new Facebook Live setup is I'm not sure that I can see questions at the moment. Um, so, oh, I do see. Okay, I do have a couple questions. One question is, can you tell if two kitties are really siblings through a blood test? I couldn't. I couldn't tell that. There is probably some kind of DNA testing out there that could be helpful, but I do not know what it is. And Kathy also says that she can practice this type of handling at home. It's really helpful. So thank you. I'm really glad. And of course, not everyone is going to be a lump on a log like this guy Otto, but it is really nice to have your pets handled in this way and have them have the feel of what it's like to have their legs touched and their necks touched and all that stuff. So it's not quite so scary. So I would say any kind of handling that is gentle and just all over the body is a great thing, so that we're not the first person to put their hands on their leg or put their hands under their neck. It might be a little bit less scary for them. All right, and Donna asks, is there a choice for kitties? Is it usually better to do a 1-year rabies vaccine or a 3-year? Oh, Donna, this is such a great question. Okay, cats, always a little bit different. So, cats have this unique ability to, when they are given vaccines, they can sometimes develop an kind of inappropriate response where they get a cancerous lesion called a sarcoma. So we're very careful about vaccinating cats. It has changed the location of where we vaccinate them. So that if they were to develop this, it is not a common occurrence, but it's certainly way more common than dogs. It is something particular about cats that lead them to have this response. So we use different kinds of vaccines for them, and we also use different locations of where we actually place the vaccine in their body. So in an ideal world, they would get a 3-year rabies vaccine. Most feline vets prefer to use one called the PureVax vaccine because it has a different makeup that has a lesser chance of causing that sarcoma lesion to develop. I believe that I just learned from my lovely associate Steph that there are two versions of PureVax now. One is a 3-year vaccine and one is a 1-year vaccine. The 3-year vaccine is like significantly more expensive. However, if it were up to me, less is more, so I would choose that one. That depends on what your vet has available and what they recommend. I know that probably feline vets are going to be the most adept at answering that question because they do that more than I do. Um, and so I would say check with your veterinarian, and make sure that we are in cahoots on this. But the 3 years always going to be a little bit better. Another question is, if your cat is an indoor cat only, why do they need a rabies vaccine? Very, very good question. Okay, so if they are indoor only, they can still technically be at risk um, for rabies. So the common situations would be if they get out of the house and they're not protected. Most cats, are happy to be home dwellers, but if they get scared and spooked and they leave the house for some reason, or if they're the type of cat that goes out on walkabouts, as we call them at our house, when they're not authorized, then rabies vaccine is really important, because if they come across someone who had like a raccoon or a skunk or something and get into it with them, and if they are not vaccinated for rabies, then they are the one that has to be quarantined. If they have any symptoms of rabies, that is really, really bad news because we have to test them, and that means not good things. So the other thing, and the quarantines can sometimes be for as long as 6 months. So the other reason would be there are animals that can get into our homes. The most noteworthy is the bat. So they talk about that in the people ERs a bunch with like if you have a bat in your house, how susceptible are you to um, rabies. And so if there's just no way of saying that while that's not super super likely, it is likely enough that the consequences of having someone not protected against rabies is tough enough that that then most people I think would feel better having their cat vaccinated for that reason. I hope that makes sense. um, and Donna says she's had a bat in her apartment, was so happy that her cats were vaccinated. Absolutely. Because it is really, really tricky stuff. So I guess I should clarify that if an animal is showing signs of rabies, that can mean that they might lose their life. So it's just such a tricky, tricky thing that's why vets, myself included, tend to err on the side of being protected. Um, Karen asks, she's read articles about how rabies vaccine can last up to 10 years in a cat system. So is the titer okay for indoor cats to avoid giving them the vaccine? It's tricky. It is probably true that many animals can mount a particular response, but one, we don't have all the data to tell us what a like significant enough response is, to my knowledge. But also, it's also those risk factors. So if it, in the eyes of Massachusetts, I will say, if the animal is exposed to something that could be rabid and they are not vaccinated, we still have to employ the same quarantines, boosters, all that stuff. And so that is why we worry so much. So it is, while it is unlikely that it will have a consequence for the particular cat, um, it is one of the trickiest things and the most, I would say, kind of like um, adhered to guidelines we have in public health and animals. I hope that makes sense. All right, I think those are all my questions. I hope I answered them well. If you have more questions, please let me know. And any topics that you are interested in, also let us know. You can write in the comments here, or you can email us at dreamteam@sleepydog.vet. And we look forward to seeing you next time. I think our next topic is going to be inappropriate urination, everyone's favorite thing to fear. So stay tuned for our next FaceTime Live and that topic. Okay, thanks guys. Have a great snow day if you're in New England. Bye-bye.